Good evening, everyone. I'm very happy that we have already quite a few participants which are interested in this interesting webinar on the containment strategies for COVID-19. And we are very honored and proud that the ambassador of the Republic of Korea, Mr. Yoon, has joined us today. I'm very happy that the ambassador is here with us, and also that my colleague from European Parliament, Reinhard Bütikofer, has agreed to do this webinar together with me. We are really proud to have so many participants, because as it's in English, it's always a little bit difficult for German attendees to watch. I would like to give a very short introduction on the technical things. You're all muted and you should not unmute yourself. We will mute you for your questions. We will take written questions and which you can put in the chat, or we can also take oral questions. I'll do a list of those people who have been raising their hand, and you can then pose your question in due time. I will call you by your pre-name only in order to have the necessary privacy for those who don't want their names to be shared. As I said, we're very honored to have Mr. Yoon here because the Republic of Korea has done a very great job in their fight against COVID-19. And I think there is quite a few lessons which we can learn, especially as we have the highest death rate yet in the European Union compared to all other countries. If we look at the European Union as a union, and then we have more fatalities than the USA yet. And I would be very much interested in how Korea has managed, but first of all, I would like to give over to my good friend Reinhard Bütikofer, who will introduce our honored ambassador.
Good evening also from my side, everybody. Thank you, Jutta. Welcome, Ambassador Yoon. It is an honor and a privilege to share this hour with you. There are quite a few issues that we might be interested in discussing with Korean interlocutors, in particular, since you just had a parliamentary election on the 15th of April, which was won by the Democratic Party and which has been creating some interest here in Europe also because the president announced that Korea would pursue a Green New Deal and would set for itself the goal of reaching net CO2 zero emissions by 2050 and would be the first country in East Asia to do so. But for tonight, we have your activities, the Korean experience in fighting the COVID-19 virus. Ambassador Yoon Sung-gu has a very distinguished career. He was educated at the Seoul National University and at Penn State. He served for the Korean Ministry of Foreign Affairs in the US, Algeria, Egypt, and with international organizations in Switzerland. He held different positions in, if I count correctly, 4 or 5 ministries: Ministry of Interior, Ministry of National Defense, MOSPA, Foreign Affairs and Trade. And his last position before he became the ambassador to the EU, to Belgium, and to Luxembourg was the rank of Deputy Minister of the Ministry of Foreign Affairs of the Republic of Korea. We are grateful that you share your time with us, Ambassador, and the floor is now yours.
Thank you very much. It's my pleasure to see you, and thank you for having me. It's a It's a great opportunity to share with you Korea's experience to fight against the COVID-19. Before I going further, let me introduce my colleagues that are sitting behind me. Political Counselor, Mr. Lim, and the Health and Social Welfare Counselor, Mr. Jung. They are working for a Ministry of, working for Embassy of Korea here in Belgium. Once again, thank you. Thank you for addressing, thank you for giving me a good opportunities. And well, the global community is facing the unprecedented crisis with the spread of COVID-19. I'd like to share Korea's experience and lessons learned in our fight against COVID-19. Hopefully, this information will help European partners in their fight against COVID-19 while minimizing disruptions in our daily lives. Before I move on to the main agenda, let me make a few points in advance, a general point in advance. Korea has successfully made the curve flattened. Indeed, it's fair to say that Korea cases seem quite successful, even though it's not the only perfect models for all countries to follow. But we know that you know, still it hasn't come to an end yet. So we have to keep vigilant. Having said that, let me begin by briefly presenting the current COVID-19 situation in Korea and elaborate on our response to the crisis based on the core principles of openness, transparency, and the democratic values, as well as our effective control strategies to test, trace, and treat. And then I will explain our trust campaign, which stands for transparency, responsibility, united action, science, and together in solidarity. This word is quite diverse place with many different cultures and values, but we believe that trust can be a universal guiding principles that other countries can apply in their fight against COVID-19. And finally, we will propose that the only way forward to combat this pandemic is based on global alliance that requires close cooperation of every country. The virus knows no border and doesn't discriminate. The next page, please. And next. Okay. At the beginning of the outbreak, the exhaustive testing in the epicenter of Daegu, the third largest city in Korea, resulted in a surge of hundreds of new cases every day. The Republic of Korea responded promptly to locate and place all contact of confirmed cases into quarantines. And these swift action effectively contained the virus from spreading to other regions without having to lock down the entire city. This allowed people in other areas of Korea to continue their economic activities with precautions, thereby greatly reducing this disruptive effect on the economy and their daily lives. WHO proclaimed the public health emergency of international concerns on 30th of January, and it's categorized the pandemics on the March 11th. New confirmed cases per day in Korea reached its peak of 909 on 29th of February. Since mid-March, the daily number of patients who fully recovered, tested negative for COVID-19, and discharged from hospitals or treatment centers, the figure shown in red color, has surpassed the number of new confirmed cases. Since the 12th of April, the number of new confirmed cases per day has averaged around 30 per day. Around 50% of these cases involved travelers from overseas. Of course, the fatality rate have been hovering around the 22%. However, we will continue to be vigilant, as we are aware that the sporadic spikes and the growing cases from inbound travelers can lead to further outbreak. In other words, Korea was able to successfully flatten the curve on COVID-19 in only 20 days without forcing extreme draconian measures that restrict freedom and movement of people. Next slide, please. Each country is faced with its own political, social, and economic challenges, but Korea's experience could provide valuable insight and lay the foundation for effective control strategies that minimize the disruptions to people's daily lives. Korea, a vibrant democratic society, as you indicated, it relies on international trade and the flow of people, goods, and services. Korea has a robust public health care system, which was strengthened after experiencing severe acute respiratory syndrome in 2003 and Middle Eastern respiratory syndromes in 2015, as well as one of the most advanced information and communications infrastructure in the world. Koreans also have a high level of civic awareness, which guides their behavior, especially in times of crisis, actively practicing social distancing and voluntarily taking necessary precaution measures. Such factors allowed and to the extent obliged the Korean government to adopt a more preemptive, rigorous, and innovative approach while respecting democratic values and maintaining openness and transparency. ICT served as quite a vital instrument in fighting COVID in Korea. Mobile devices were used to support early testing and contact tracing. Advanced ICT were particularly useful in spreading key emergency informations on novel virus and helps to maintain extensive social distancing. And next slide, please. Robust diagnostic testing capability lies at the core of our control strategies. Our current diagnostic testing capability is up to 20,000 tests per day. As of today, more than 500,000 COVID-19 tests have been conducted. This was possible due to the fast-track authorization of test kits developed by the biotech companies, rapid transfer of technology to relevant sectors, and close cooperation between public and private institutions to facilitate large-scale testings. Currently, COVID-19 tests are conducted at 118 testing institutions across the countries, including the Korean Centers for Disease Control and Prevention, national quarantine stations, research institutes of public health and environment, and other private medical laboratories and hospitals. The Korean government ensured that testing was easily and readily accessible by the public, while the safety of frontline medical workers were protected by introducing drive-through and phone booth testing stations. Testing is free for suspected patients who are referred by doctors or anyone who have been in contact with confirmed cases, regardless of their nationalities. Next page. Korean government is vigorously tracking those who have been in contact with confirmed cases, utilizing credit card transaction history, CCTV footage, and mobile phone GPS data when necessary. Within the scope of a domestic law, which is called the Infectious Disease Control and Prevention Act, every effort is made to protect any personal information, and only relevant anonymous information is disclosed to the public to alert others that may have come in contact with the confirmed patients. Any contacts identified through epidemiological investigations are tested for COVID-19, put under self-quarantine, and are assigned to case workers via self-quarantine safety and protection applications, which allows officials to monitor their symptoms twice a day and be alerted when they break self-quarantine by tracking their GPS. Next slide, please. As COVID-19 infection can manifest with mild or no symptoms, we prioritize early detection through preemptive screening and rigorous contact tracings, followed by treatment at the earliest possible stage to increase the likelihood of recoveries. As a result, COVID case fatality rate in Korea is very low. As I told you, currently it's hovering around 2.2%. At the beginning of the outbreak, all confirmed patients were placed into hospitals to prevent community spread. But we promptly learned that even the most robust healthcare system would quickly run out of capacity. To make sure that the critical care resources were available for those in serious conditions, a patient management system was established where a network of medical professionals categorized the patients into 4 groups based on conditions and assigns them to appropriate care facilities. To manage the sudden influx of cases, the government designated 67 hospitals to exclusively treat the COVID-19 patients. Patients with mild symptoms are accommodated in temporary quarantine facilities, calling living treatment centers, and checked by healthcare professionals at least twice a day. Patients in moderate, severe, and extreme severe groups are immediately placed in designated hospitals based on the categories. Next slide, please. The Korean government put measures in place to manage the potential risk of a cross-border traffic, not with blanket entry bans, but with continuous adaptations and fine-tuning of measures that are designed to control and track inbound travelers. These measures include special entry procedures, self-diagnosis mobile applications, mandatory testing, and self-quarantine for 2 weeks of all inbound travelers. Special measures to prevent the spread of a virus from Korea was also implemented, such as the ban on the exit of anyone under self-quarantine and COVID-19 free airport programs, which include a 3-step temperature monitoring programs on outbound passengers. Next slide. All of the effort and measures to combat COVID-19 that we have covered so far in these presentations were initially characterized into 4 trust campaigns, which stood for transparency, robust screening and quarantine, unique but universally applicable solutions, and strict control and treatment. Next slide. This slide summarizes the lessons that we have learned in fighting against the COVID-19. Transparency, responsibility, united actions, and science and speak, and together in solidarities. So we are launching a campaign of trust. Korea is committed to sharing its information, best practices, and lessons learned with the international community. Korea also stands against xenophobia and discriminations. Next slide, please. I skipped all major part of this slide. Next is about how to collectively fight against COVID-19. The international community is facing unprecedented global crisis with the spread of COVID-19, which has stalled or ended the lives of those infected by the virus, restricted movement of people, closed the borders, and disrupted the global supply and disruption network, and spread panic, xenophobia. To beat COVID-19 and recover from the devastation it has brought, an unprecedented level of global cooperation and solidarity is needed. No country will be completely safe until whole world recovers. Next slide, please. The Republic of Korea has successfully managed to contain the initial spread of virus, and we are actively assisting our international partners with best practices, lessons learned, data, supplies, and other resources. The Korean government is also holding bilateral and multilateral telephone and video consultation with many countries at the various levels and sectors, such as the disease control and prevention agencies, to share information and formulate coordinated responses. We are doing our utmost effort to meet the demand in other countries for medical equipment and supplies by ramping up domestic production capabilities. Korea has already supplied a test kit to more than 40 countries and is providing other humanitarian assistance to countries with less developed healthcare systems. Next slide, please. President Moon Jae-in took part in the extraordinary virtual G20 summit, the ASEAN Plus 3, to advance a coordinated global response. Also, at the ministerial levels, a variety of virtual meetings took place. Regardless of level and format of the meetings, leaders are committed to work both individually and collectively to protect people's lives, safeguard jobs and incomes, and restore confidence, preserve financial stability, revive growth, minimize disruption in trade and global supply chains. Next slide, please. As COVID-19 began to spread globally, we witnessed instances of fear, xenophobia, and discrimination, including a verbal physical attack targeting Asians all too often. As emphasized by Foreign Minister Kang Kyung-hwa in her BBC interviews, it is the government's responsibility to stop the spread of the xenophobia and discriminations and work toward forging solidarity in the midst of the epidemics. Next slide, please. Lastly, let me briefly touch upon Korea-European Union cooperations in these domains. Okay, let me skip this slide. Last slide. The next slide, please. We have provided quite important medical equipment, including testing kits to such European countries as Italy, Spain, Hungary, Ireland, Portugal, and Greece. And recently, on the 8th of April, C-17 Global Master NATO cargo planes actually carried 45 tons of protective medical suit from Seoul to Budapest as a part of effort to combat the effect of corona pandemics. And also, quite recently, we had a chance to exchange our views on how to combat a spread of coronavirus with the German side. Germany's the intergovernmental agency team had a chance to speak with a Korean counterpart, and also a variety of virtual teleconference took place at the various levels, including foreign ministers and some things. So briefly, I presented our experience, the learned that we got from our struggles to fight COVID-19. Thank you for listening.
Thank you very much, Your Excellency. Jutta?
Yes, thank you very much. That was very, very comprehensive. A lot of information on your slides there, and I think we all are looking at this very, very much impressed, because you managed to do a lot in a very short time. What would you say? What was the most decisive decisive measure? What was the measure which really did make, what was the make or break measure? What would you say?
Well, you know, as everybody acknowledged, the successful story is of Korea. Was that testing is a quite important part of our
Okay.
effort. Well, you know, since the eruptions of SARS pandemics in 2015, we introduced, you know, the fast track authorizations to the Korean companies. So I think that's since then, I think that's you know, the many Korean innovative companies try to develop, you know, testing kits. That is one of the key words of our successful stories, I believe.
Okay. Okay. So that you had so many test kits readily available, because I think that's a shortage in many countries, that they just don't have enough tests to test everyone who should be tested.
Yes, regardless of its nationalities, any people who want to get tested, they can do that. You know. In most cases, of course, the government pay the testing cost.
Wow.
Ambassador, one question that I got concerns North Korea. Do you have any information as regards how COVID-19 has hit that part of Korea?
Well, you know, so far, North Korean authority do not admit that you know, coronavirus you know, took place in their soil, but we offered any, you know, the assistance if they want. But still, you know, they do not admit that you know, coronavirus took place in their soils.
Okay. Another question that I got, Ambassador, pertains to the economic situation as it might be influenced by the corona crisis. Now, you did mention that you avoided a sharp economic shutdown. Still, it might be interesting to learn a little bit more about what the economic impact has been on Korea's economy. And one participant asked a very specific question regarding the steel sector, whether there so far has been any effect of the crisis on the steel sector, and whether there is possibly a specific strategy to deal with that.
Of course, you know, we are heavily affected by the coronavirus, including the economic side, because as I told you, Korea is an open economy with quite heavily dependence to the international markets. So needless to say that. And, you know, but in accordance with the outside watchers, Korea's GDP this year is expected to drop around you know, 2 or 3%. So it's compared with the other advanced countries, our record would not be bad at all. But still, you know, so we have heavily affected by the coronavirus. You know, so particularly #1 disruption of global supply chains is one of the key factors. The second one is that there's no demand from the outside of the world. You know, we have you know, exported many manufactured goods to the outside of the world, but due to the outbreak of a coronavirus, there's quite a significant shortage of demand from the foreign markets, foreign source. So obviously, we have been heavily affected economically. So my government offered quite a generous, rescue package to the Korean civil societies.
Oh, okay. May I pose two more health-related questions? In Germany, the debate is going, well, people who die, those are people who are already 80 years old, and they would have died anyhow in the next few years. So I would like to know, do you have the average age of the fatalities in the Republic of Korea? And an additional question, Ambassador, if I may, how did you quarantine? Were people quarantined to their own homes, or did you have like hotels or any special facilities where the quarantine should be observed?
Well, so let me give you my answer to the second question first. Well, there are two different types of quarantines. To the confirmed cases, confirmed patients, depending upon their severities, most of the confirmed patients would be taken into the hospital, special hospitals.
Okay.
But some suspected, the people with suspected symptoms, depending upon their gravities, some people will be taken to the special centers for curing these symptoms, and some people with serious symptoms, they could be taken to the hospitals. But in most cases, since the outbreak of this pandemics, due to the shortage of our accommodating those patients, the people with some symptoms, not confirmed patients, most of them will be taken to the special centers for around, the 2 weeks. Yes, 2 weeks.
Okay.
And you said so fatality, the composition of dead peoples. Let me take a look at our statistics. Well, we have quite the different types of statistics compared with the other advanced countries. In our case, most confirmed cases come from the age group of 20s. Simply because most of them, had the chance to visit China, so they have been infected. I assume, and the people who lost their lives, so most of them lost their lives in hospitals, and some in nursing homes, of course, as well.
And the people who died were also young people?
Not that much, in terms of a composition of well, around we have so far a 230 around, among whom 120 are above 80s.
Okay,
80s.
I see.
Only there's no death tolls at the age group of 20s.
Okay.
In spite of the fact that we have most cases, most confirmed cases in the 20s, but mostly people who died are from the senior peoples over 80s.
Yes, and you had, of course, the advantage of being able to treat everyone because your health system was not overwhelmed with so many patients. Thank you very much, Ambassador, for answering me.
I have a few questions that have been sent in. I would like to start with a question from a political scientist from a university in Berlin. She writes that she was very grateful, Ambassador, for you to mention that xenophobia and xenophobia is not helpful in this situation. And then she poses a question, what role does the civil society play in the fight against COVID-19 in South Korea?
Well, I think that's, the first step that civil society can do is to increase awareness, people's awareness. This disease is a challenge against the humanities, and regardless of its origins. This is not the disease which was originated, in Asia, so with some malicious intentions, actually. So this is a common challenge that we need to address collectively. So basically, we need some coordinated, concerted effort internationally, to address this disease. A finger pointing will not be helpful under any circumstance.
I would like.
Oh, sorry. You go. You go.
I have some hands raised, so I would like to give the floor to Cameron, whom I have just unmuted. Cameron?
Oh, Ambassador, excellent presentation. Thank you very much. I wanted to ask about cooperation with your neighbors, and in particular, Japan. One would hope that the pandemic was an opportunity to improve relations between the Republic of Korea and Japan. Has there been any cooperation so far? And could you envisage further cooperation?
Well, Japan is quite important neighbor to us, and also I believe the vice versa. Quite recently, I read a newspaper through which I learned that Japanese civil aviation, transported some numbers of Korean citizens to my home countries. This is a typical examples of cooperations. Of course, so at the summit level, so we had chance to discuss these pandemic issues among the leaders of three countries: Japan, Korea, and China. This is issues which need a close coordination among the key players of international communities, and also at the regional basis, we have some roles, where some regional players can contribute to prevent further spreading of this disease. For that sense, I think that we need to increase our cooperation with neighbors, including Japan. I think that's we are sharing key information which has been driven from some empirical research with Japan and other neighboring countries.
Ambassador, one question cites the high level of civic awareness in Korea that you have described. And then the question goes on saying, in Germany, people still refuse to wear masks unless officially regulated. Do you see a Confucian ethics argument here, or why were Korean citizens so quick to arrange with the situation? And how can we learn from how you managed to convince citizens to raise awareness and to display the consequences of awareness?
Well, firstly, as I told you, we had endured, quite a catastrophic consequences of a SARS in 2015. That helped a lot, I believe. And in terms of cultural aspect, in Asia, many people used to wear the mask. So we have no, the psychological, the hindrances to wear the mask. You said that, well, so it's quite difficult to give you the exact answers. I think that's basically, the basic point that I'd like to argue at this juncture is that we need to increase people's awareness on the real cause and how to address these pandemics. So the only answer might be a further coordination and cooperation among key players of international community. For example, once it will be spread out to the other developing continent, including Africa and some things, they don't have a sufficient healthcare systems. And well, I think that some countries with some abundant medical resources, you know, so they need to help voluntarily. They need to help some developing countries. So in order for achieve that objectives, there's no other way but to increase our cooperation and coordinations. I refer to your original questions. Well, basically, this pandemic has nothing to do with race and you know, the ethnicities and other aspect of a you know, a culture.
Mm-hmm.
You have already answered one question that I didn't even read, that that asked for the role that your experience with SARS had, and you have answered in the positive that it did have significant relevancy. Now there's another question that someone has sent in, and I read it to you. How is data privacy guaranteed in the use of the ICT measures?
Well, that was quite controversial in our society also, but we adopted a national law which permits the use of the ICT technologies to prevent the spread of the pandemic. Well, the point I'd like to make is that this was the outcome and the result of our quite heated debate within the societies. And also we have many restrictions to use these ICT technologies. Firstly, any personal information would not be disclosed to the publics who do not need to know actually. And also all the personal information could be codified in the anonymous ways. So we have quite strong bulwarks to disclose all the personal informations. Basically, this is quite important outcomes of our heated debate in our society due to these preparations. I believe that we managed to contain the spread of this virus. In the 2015, as I told you, SARS made us to give fast authorizations, by testing kits. This is quite important, the examples of my argument.
There is a pertaining question from someone saying, how high is the acceptance now of the Corona app in Korea?
91
among the population.
91.3%. Current statistics is 91.3%.
Okay.
91.3% people have responded voluntarily.
And then there is a rather technical question, and I will also read it to you. As someone from Hamburg writes the following: I'd like to learn a little more about your tracing strategy. As I understood, it is based on one GPS-based app combined with data from CCTV, face recognition technology, and data from public transportation usage. In Germany, the application based on the European PEPP-PT standard is still in development. How could you compare these two different tracking strategies?
Well, so I don't know much about the German systems, but Korea instruments, the instrument that Korea has developed, once a people's is a confirmed positive. The self quarantine procedures will be implemented. So once you are the patients of coronavirus, he or she, no matter what the genders, should install the GPS-based tracking systems. So if he or she was proven to contact with the other peoples, if it's necessary, some law enforcing officers could get some information, personal information through the credit card transaction information, CCTV information, and all other sources, all major sources. It was enacted by the Korean law, so we don't have any legal restraint to get that. Again, this is the result of our controversial internal debate. So we don't have any other objections to implement this the tracing or tracking mechanisms.
Then, Jutta, can I continue with questions?
I don't see raised hands. I think everyone is just typing the questions in the window. So now we have one more medical question saying Korean doctors mentioned that one factor for the initial quick spread of the virus was hours of singing together in the religious group, and that it has also been suggested that shouting has the same impact because you aerosolize the coronavirus droplets and it's spread rather widely. Apart from limiting groups and promoting social distancing, were there other measures taken to address these risks, such as alerting people from these particular risks related to aerosolizing, difficult word, the virus droplets to aerosol floating in air? And I don't know whether you've seen, there has been a study done in China where the droplets were actually distributed by the climatization system of a restaurant, so that the droplets were transferred from one table to the other.
Well, so as I indicated, the people in the 20s were infected, in China. Many of them, they went to China for missionary works. It's missionary works, Christianity, for a spreading Christianity belief. So they chanted and they sang a song, probably. So those the special religious groups were concentrated in specific areas, as I told you, in Daegu, southeast regions, far away from the capitals. So most of the confirmed cases, around the 50%, around 50% come from the Daegu, the third largest cities of Korea. I don't know, what factors have contributed to spreading coronavirus, but basically, they are religious groups. So I assume that they have many chances to, sing a song or chat and some things, but I don't know exactly what happened to them, or how they could be, the affected by the others, but what is certain is that most of them had a chance to travel to China, so they have been affected in China.
Thank you, Ambassador.
Ambassador, there's Well, the questions keep flowing in. I'm grateful for your patience. There's another question that goes back to your remark about concerns over supply chains.
Mm-hmm.
And the question mentions that in the US, some people are arguing for a decoupling from China to have safer supply chains. I could add that the High Representative, Vice President Borrell, in a remote meeting with the AFET committee today, also mentioned that he felt it might be necessary to reshore some of the production facilities, in particular for some critical medicine. We have seen reshoring initiatives from the Australian government and also the Japanese government. So in adding to the question of the participant, I would like to ask you, how does Korea look at these supply chain issues and the reshoring concerns?
Well, many experts are also, worrying that this coronavirus will have a negative impact on the on global economies, which is featuring the free trade, and many political leaders indicated that reassuring initiatives is inevitable because in order to survive this pandemics, key industries like the medicine productions companies should be in place in their own countries. But so Korea is basically as a trading country, so we are heavily dependent on the external market, and in order to enjoy some flourishing the effect of capitalism, I think that's basically free trade should serve as a guiding principles. So reassuring initiative would not be an answer in my humble views. But basically, we are, quite intrinsically connected with the other players. For example, so you talked about the global supply chains. We had many facilities to produce, the intermediate components of manufactured goods in China, for example. When the coronavirus was initiated in China, we were short of we suffered from the shortage of our supply of intermediate goods. This is a typical examples. We are already heavily interconnected. We are living in interdependent world. So I think that reassuring initiative, of course, these are quite reasonable and quite imaginable. In other words, imaginable that many countries will pursue the reassuring of key industries. But so already we are entering into the heavily interdependent world. So so we need to, of course, we need to have a stable global supply chains. But in order to avoid this kinds of side effect of heavily the intrinsic global supply chains, reassuring initiative would not be an answer to us, I believe.
Thank you, Ambassador. I would propose that we give you one more question because we're about to run out of time. We have 5 minutes left. If I may, Jutta, I would like to ask one more question, or do you have one?
I haven't seen a hand raised actually. So I think the question which Jens wrote in the chart is really a very good question to take it as a last question for this hour, because it says, how can Korea and the EU strengthen the global pandemic response now and in the future? because we very well know that this will not be the last pandemic to hit the earth. We can be sure of that. And so that's a very interesting question for the end of this webinar. Thank you, Mr. Ambassador, Your Excellency.
It's a quite valid questions. It's excellent questions. But I think that we share the same goal with the European Union, basically. So Korea is one of the 10 strategic partners to European Unions. I think that European Union's prescriptions also, I think they are quite identical with ours. So we need to increase our cooperation and coordination rather than shrinking into the some narrowly focused objectives. Well, so there are many ways. European Unions now is advocating green deals as well as the digital-based economies. That is one of the ways that one of the areas that we can increase our cooperations, and also the mutually supporting of the medical goods also one of the key the lesson that we could learn from this pandemics. So once you are going to your side, the European Union is going to short of medical equipments and the supplies. We could provide some assistance to you, and once that happens to us, your side also could help us out. So this also one of the areas that we could cooperate each other, and there are many other ways. Again, European Union's would be in line with ours. In that we are outlooking economies. Actually, it's a fundamental principles of a free trade and multilateralism should guide us to the new world after pandemics. So I think in that sense, we are natural partners to European Unions. For that purpose, we are now thinking about how to increase our high-level exchange between two blocks.
Thank you very much, Ambassador. Those were wise words, and we will carry your message on and we'll share it with others. I just want to thank you for your willingness to engage with us. I want to thank the participants of this webinar to have listened in, and I hope they will also spread the information that they have learned from you. Thank you very much.
Once again, thank you for inviting me, and it's really a pleasure to engage with you. Thank you.
From my side too, thank you very much, Your Excellency. We're very honored to have had you with us, and thanks to all the participants and also to the technical staff who worked relentlessly in the background, making this run so smoothly. And now I wish everyone a very nice evening and hopefully good health, and stay safe, stay home. Good night.
Good night.
The German punctuality, it ended at 7.
Well.